Hey y'all, my name is Liz. I'm a physical therapist at Haynes Physical Therapy in Weatherford, Texas. This is our rehab tech, Shelby. She's going to be showing y'all some exercises. But what we're going to talk about today is patellofemoral pain syndrome, how you know if you have it, and what are some exercises and stretches you can do to help eliminate some of the pain that you're feeling. So patellofemoral pain is an overuse injury. Typically, you have some abnormal tracking of that patella in that femoral groove, and that creates a lot of pressure in a really small area, and that creates some irritation. And typically when you get a little bit of irritation going on with overuse, it just becomes more and more of an issue. So typically patients we see have issues ascending and descending stairs, running, walking for long periods of time, squatting, anything that compresses that patella into its femoral tract just a little bit more, causing a little bit of irritation. Some tests you can do at home to determine if you think you have patellofemoral pain are called the squat test and single leg squat test. So I'm gonna have Shelby do a squat for me. Perfect. And typically with this motion, patients will have pain underneath or around that patella. So then with the single leg squat, I'm just gonna go down, have that pain just a little bit more, and back up. So those are some tests you can do at home to determine if you think you have some patellofemoral pain going on. Some things that we typically see with patellofemoral pain is really hyperactive quads and really weak hip musculature. So typically what we see with patellofemoral pain is you have some hyperactive quads going on, causing that increased pressure on that patellofemoral joint. And we also see some tightness of the IT band, maybe even some weakness of the glutes. So some things Shelby is going to show us are some ways we can strengthen those glutes, stretch for the hamstring, and a stretch for the IT band. So first, Shelby's going to lay on her side. We're going to do some clams. All right, so what you do is you lay on your side just like this. Think about keeping those hips nice and stacked and those heels glued together, and you're just going to raise that knee up towards the ceiling and back down. I want you feeling that muscle burn right back here. The next exercise we're going to do, Shelby's going to get on all fours, and we're going to do what I call a fire hydrant. So Shelby's going to transition all of her weight onto her right leg and kick up that left leg, just like that, working the side of her glutes. What's important to remember here is we want to keep our hips nice and level. If I have a glass of water on Shelby's back, I don't want it flying off the other side when she lifts it. So it's not a huge motion. The next one is going to be donkey kicks, working on strengthening that glute max. She's just going to kick that leg straight out. Again, making sure we keep our hips nice and level when we do this. If it's too hard on your wrist, you can always go down on your forearms, make it a little bit less intense on your arms. And then for some stretches, we're going to have Shelby lay on her back. We're going to do the hamstring stretch. There are many ways to do this. You don't have to do it this way, but if you have a strap, dog leash, long towel at home, this is easy. She's going to bring her toe up, leg up, focus on keeping that knee nice and straight, and hold it for about 20 seconds, 3 times. And then for the IT band, what we want Shelby to do is we loop this around her foot. She's going to bring her leg up and across her body. She should feel some stretch going on this side of that leg. And those are just some things you can do to help try to alleviate some of your patellofemoral pain. Again, it is an overuse injury, so always resting and giving those tissues time to recover is important. But again, if you have any questions or concerns, please feel free to contact us at Haynes Physical Therapy. Thanks.